What signs and symptoms are correlated with DTI-positive TBI?
There's 8. The first one is if the patient had a positive CT scan already. We're not talking about a DTI scan, just a plain vanilla brain CT scan. This is most commonly the first imaging study that a trauma victim gets when he or she's taken to the ER. If that shows macroscopic traumatic brain injury, like a subdural hematoma, epidural hematoma, subarachnoid hemorrhage, interventricular hemorrhage, any number, diffuse axonal injury, any number of CT scan grossly positive findings, that signifies severe head trauma. And at the microscopic level, there's almost certainly traumatic brain injury that would be demonstrable on a DTI scan. So there's strong correlation between head CT positivity after trauma and DTI positivity for traumatic brain injury at the microscopic level. The second big correlating sign and symptom is loss of consciousness. This is a big one. I think loss of consciousness is perceived as something relatively benign because I believe most people think about the loss of consciousness associated with emotion, and that's certainly one type. For example, a young woman is surprised and proposed to by her fiance who gets down on one knee. She's overwhelmed with emotion and she, quote unquote, passes out. She certainly lost consciousness briefly. That is vasovagal syncope associated with emotions and blood pressure. That is indeed benign. That's not the type of loss of consciousness we're referring to. Loss of consciousness associated with trauma, immediately after trauma, this is more ominous. This is basically the brain's electric circuitry has taken such a shock that it's basically shut down for a few seconds or a minute or two. And it's the brain telling the body, whoa, that was big trauma. I need to recover my resources and wake back up. So loss of consciousness associated with trauma is quite ominous. It indicates there's a lot of trauma and there's a high correlation with microscopic traumatic brain injury that is often down the line visible on DTI scanning. Beyond that, there's another 6 sort of constellation of symptoms. They often occur in clusters, not in isolation. Memory or concentration problems, depression or anxiety, mood swings and personality changes, bursts of anger, that sort of thing, speech abnormalities, sleep abnormalities, and difficulty in planning or critical thinking. Those of you in the personal injury space, you've probably seen these sort of symptoms a lot. They're telltale signs of traumatic brain injury. And the more of those there are, the more likely there is indeed traumatic brain injury that would be evident on DTI scanning.